Prevention is key and critical. The main preventive measures include improving access to not only high quality foods, but also to healthcare and environmental services, and improving access to knowledge and optimal young child feeding and caring practices. This involves strengthening counseling and communication skills of community health volunteers and on exclusive breastfeeding for the first 6 months, age-appropriate complementary feeding for all children 6 to 24 months of age, including use of locally available foods where appropriate, and where required, providing multiple micronutrient powders, early child stimulation and responsive feeding, good hygiene practices for protecting children from infections. Nepal has recently launched a multi-sectoral nutrition plan to accelerate reduction of maternal and child undernutrition. It has called for strengthening of the linkages with other non-health sector programs for synergistic effects on nutrition, such as early child development and social protection, that aim to create community support mechanisms on early child care and development, involving community leaders and facilitators, and to protect children from the poorest and most disadvantaged population groups from undernutrition. In Nepal, the level of poverty has declined because of increased remittances, but 1 out of 4 still live before the poverty line. Plus, women's workload has increased due to increased male out-migration. Therefore, children are often left behind with younger siblings while their mothers are working in the farm fields, fetching water, firewood, or engaging in wage labor to raise additional income for the family. This is leading to poor child feeding and caring practices, especially among female-headed households, placing these children at greater risk of infections and malnutrition. But children that are malnourished need urgent treatment. Studies have shown that children that are severely malnourished are 5 to 20 times more likely to die unless they're identified early and treated in a timely and effective manner. The Ministry of Health and Population in Nepal and UNICEF, with funding from the European Union through the Magnesia project, is currently supporting community-based management of acute malnutrition in 11 of the most affected districts of Nepal. It aims to improve access to treatment for acute malnutrition among children 6 to 59 months of age, to promote its integration into regular health services and to create effective treatment capacity. It has 6 key components: community outreach, including screening, referral, follow-up, and community mobilization; outpatient treatment for treating severely malnourished children without complications; inpatient treatment for those with medical complications; management of moderate acute malnutrition through infant and young child feeding counseling; supply chain management of nutrition commodities; and monitoring and reporting.
धेरै दुध खानुपर्यो कम्तीमा पनि 6 पटक दुध पनि 15 मिनेट पुरा खानुपर्छ दुधको टुप्पा सबै दिनका मुखमा हालेर खानुपर्छ दुधको मुख मात्र टुप्पा मात्र धेरै दुध चुस्न सक्दैन पुरा दुधको मात्रा पाउँदैन त्यो माथि क्लियर गरिखेर दुध खुवाउनु राम्रोसँग कालो भाग भित्र दबाएर 15 मिनेटसम्म दुध खुवाउनु 7 पटक दिन 3 पटक राति गरेर 10 पटक यसलाई दुध खुवाउनु त्यसैका साथमा अस्पताल ल्याएपछि भिटामिन दिन्छ त्यो भिटामिन सँगै अब यो नखाउनु बालभिटा नखाउनु त्यो खाइसके त्यो बालभिटा राखिदिनु पछि त्यो खाइसकेपछि
दिलो टमाटर 2 छोरी छन् 2 छोरा छन्
कतिको भयो हजुरको बच्चा
यो हजुर 2 सालको हो फेरि दिवारी त खतम भइगयो भाइ दिवारी यहाँको लगा भयो यस्तो यो कुन फाँडा दिन्छ बरे हर्ता दिन्छ
कति खुवाउनु भएको लिटो
1 महिना मात्रै नानको थियो खाना पनि थिएन 6 महिना आछ्यो बारे उ खुवाएको 6 महिना बाद के खाने छ त हजुर
As of November 2013, 20,165 severely acute malnourished children were admitted in 137 outpatient therapeutic program centers of 9 districts, out of which 18,225 children were discharged. Among them, 86% were recovered, 9% have defaulted, and 0.43% died, which is outstanding results as compared with SPI standard.
हरियोमै छ सर ठिक छ अहिले बच्चाको अवस्था त्यति उपसित नहोला हामीलाई यो हरियोमा भएपछि एकदम राम्रो पेलोमा भएपछि घरेलु उपचार सम्बन्धी सल्लाह दिनु रातोमा भएपछि अब त्यो हस्पिटल पठाइदिनु भने हामी 6 महिना पुगिसकेपछि गरिहाल्छौँ 6 महिनाबाट 5 वर्षसम्मको बच्चालाई नाप्छौँ रातोमा पढेपछि चाहिँ हामी हस्पिटल पठाइदिन्छौँ उहाँबाट अब राम्रोसँग चेक गरिखेर हाम्रो पनि त तलमाथि पढ्न सक्नेहरूले चेक गरिखेर उताबाट औषधि
नेपाली अग्रसिन गावी बिराल टोली 1 नम्बर महिला समय दिदीका विगत पठाइन् समस्या विगत नाप्यो त्यो अस्पताल ल्याउँ फेरि नाप्यो नापेपछि कमजोर रहेछ भन्यो लेटो दियो लेटो खाएको 4 महिना भयो अझै नाइ ठिक छ बच्चा भन्यो अब लेटो खायो त्यो राम्रो हुन्छ अरू बच्चा हुन ठुलो हुन्छ अब खेल्ने जस्तो लाग्यो मलाई
बच्चाले राम्रो भएदेखि तपाईलाई चाहिँ कस्तो लागिरहेछ
खुसी लागेको
पखाला त छैन अरू उल्टी बान्ता ज्वरो आएर हैन ओके छैन पहिले दिनमा 3 खान्थ्यो अब दिनको 4 खानुपर्छ है वेट बढ्छ यो महिना 20 गते आउनु है अब अर्को चोटि लिनलाई है यो खाएपछि यसमा चाहिँ गोलो टिक टिक लगाउनु है
The Ministry of Health and Population and UNICEF undertook a formative evaluation of this program in 2011 and 2012. The evaluation aimed at gathering lessons for scaling up the program in the most effective and vulnerable districts. It involved in-depth interviews at national, district, facility and community levels, field observations, review of existing data and program documents, and economic analysis. The study confirmed that the program is performing well above the global standards. It identified specific areas which needed further strengthening and recommended that this should then be scaled up urgently to the most affected districts. Based on the outcome of the 2 evaluation studies, the Ministry of Health and Population, with UNICEF and European Union support, is updating the national guidelines, the protocol, training materials and tools to further strengthen integration between facility and community-based approaches and preventive and treatment measures. This will go a long way to prevent and manage acute malnutrition in children in the 11 districts of Nepal. But it's only covering 9% of the affected children nationwide. Therefore, more support is required to reach the remaining children, to prevent them from heightened risk of infections and more early death because of acute malnutrition and impaired physical growth and cognitive development.